Welcome to the Nor-Cal EMS Bleeding Control course. This course is a brief overview of the concepts and steps required to treat a patient presenting with life-threatening bleeding. This course is to serve as a review of care as well as a guide for future instructional courses you may provide. This training was developed based on the combined content of the FEMA and Telehelp Arrives and the ACS Stop the Bleed courses. This course is designed to provide both a review as well as train current providers to instruct others in the management of patients presenting with life-threatening bleeding. It will be divided into two sections. Section 1 focuses on the key concepts for addressing a patient with severe bleeding, and Section 2 focuses on hands-on management. The importance of prompt bleeding management cannot be overstressed. For example, an injury to the femoral artery can lead to death within 90 seconds, revealing why the proliferation of training in bleeding management is paramount. The concept behind the treatment of a patient suffering of acute bleeding is simple. First call for help, then address the bleeding by exposing the wound and applying firm, direct pressure. If the bleeding is not controlled by these basic steps, use further bleeding management options addressed later in the course. These important concepts can be summarized in 5 steps. Ensuring personal safety, requesting assistance through calling 911 or requesting additional resources, addressing life-threatening bleeding, positioning the patient to ensure optimum bleeding control and patient comfort, and keeping the patient warm. Ensuring that these steps are addressed significantly decreases the likelihood of patient deterioration. First and foremost is ensuring personal safety. During a stressful event, a person may become overwhelmed by the urge to assist. They may not register the fire or spilled chemicals. They may not ask themselves how the individual received a gunshot wound or whether the shooter is still active. These are details that cannot be overlooked, as one victim may become two. These are some considerations before assisting a bleeding patient. Step 2 involves asking for help. In the unfortunate event of an injury causing life-threatening bleeding, responders must understand the priority of summoning 911 resources prior to approaching the patient. Here are examples of important information to be considered when speaking with 911 dispatch. Once your safety is ensured and help is on the way, it is time to address the bleeding. The sooner this occurs, the higher the likelihood a person survives. The EMS response times alone are often too long to save a patient with life-threatening bleeding, which is why 35% of pre-hospital traumatic deaths occur due to blood loss. Quickly finding the source of bleeding, applying direct pressure, and utilizing the tools presented in this training saves lives. Once the bleeding is addressed, it is important to position the patient. Should a patient be alert, allow them to position themselves. Never force a patient to sit up. Patients suffering from prolonged bleeding may not have sufficient volume to perfuse the brain if sat up. Due to gravity, blood will be pulled from the brain, causing a decrease in mentation and/or loss of consciousness. Should the patient be unconscious, place them in the recovery position. The recovery position involves laying the patient on their side. This best ensures brain perfusion as well as an open airway should the patient unexpectedly vomit. Continued pressure is essential once the patient is placed in the recovery position. Finally, keep the patient warm while continuing to hold direct pressure. This assists in perfusion and decreases the risk of hypothermia, which causes blood to be shunted to the core and away from the brain. The 5 important steps of ensuring personal safety: calling 911 for assistance or requesting additional resources, addressing life-threatening bleeding, positioning the patient to ensure optimum bleeding control and patient comfort, and keeping the patient warm significantly impacts a patient's survivability following a life-threatening injury. The following video will provide an example utilizing the steps reviewed in this section. Ensure personal safety. Call 911 or request additional resources. Manage bleeding. Position the patient. Keep the patient warm. Section 2 will focus directly on Step 3 and the principles and techniques for controlling bleeding. Section 2 will have two goals. First, we will focus on recognizing life-threatening bleeding. Then, we will learn the techniques and tools available for the control of life-threatening bleeding. Life-threatening bleeding is not always easy to find, especially if the patient is under the influence or otherwise altered. Looking thoroughly at the patient's clothing or removing excess layers may be required. Additionally, time of day may influence the difficulty of finding acute bleeding. Ample lighting is essential during the night hours. Once the bleeding source is found and accessible, apply direct pressure. Be aware that multiple bleeding sites may exist, so employ extra help if available. It is important to note there are two types of bleeding, venous and arterial. Veins carry blood to the heart at lower pressures than arteries carry it from the heart. Venous bleeds are often slower and blood appears darker in color. In contrast, arterial bleeds carry blood from the heart to the body and have higher pressure. Having higher oxygen content, blood may appear brighter in color and pour or squirt from a wound at a significant rate. Arterial bleeding is life-threatening and requires quick action. All bleeding should first be addressed through direct pressure. Should bleeding not stop, additional steps may be needed. The step utilized depends on the site of the bleeding. The sites are grouped. There are core injuries involving the armpits, groin, chest, or abdomen, junctional areas of the neck, shoulder, and groin, which may also require packing since a tourniquet cannot be used. The other is an extremity wound, where a tourniquet can be used and packing may not be optimal. Only apply the tourniquet when direct pressure is not effective to stop arterial bleeding. Apply the tourniquet 2 to 3 inches above the wound or above the joint if 2 to 3 inches would be on a joint. Never place it over a joint such as an elbow or knee, as this would not enable effective reduction in arterial flow. Once applied, ensure no slack remains and that the patient has no pulse to that extremity. This is an indication of effective placement. If time allows, write down the time of application, preferably on the tourniquet itself. Do not ever remove the tourniquet despite the level of pain of the patient. Tourniquets hurt a lot, but only a paramedic or physician is authorized to remove it. With any extremity bleeding, once the wound or sites are found, apply firm direct pressure. Once applied, never remove the bandage to check if the bleeding has stopped. If bleeding soaks the bandage, add another bandage on top of the original and repeat as needed. Should bleeding continue, a tourniquet is needed. The following is a video depicting the technique of tourniquet application. Apply direct pressure. Apply tourniquet 2 to 3 inches above the injury. Tighten until the bleeding stops. Check pulse in the affected limb. Treatment of any core injury begins the same way. Begin by finding the wound, then apply firm pressure, adding additional bandages should bleeding soak through. Should bleeding continue, core injuries require wound packing. Wound packing utilizes hemostatic dressings that, when mixed with fresh blood, immediately start a clotting process. When packing a wound, attempt to wipe or remove excess pooled blood without removing any clots. Next, push the hemostatic dressing deep into the wound, packing as full as possible. Once complete, any remaining gauze should be placed on top of the wound and continued firm pressure applied. After packing a wound, hold direct pressure for at least 3 minutes if using hemostatic dressing and 10 minutes if using regular gauze. If the original packing fails to stop the bleeding, place another on top of the previous packing. Once bleeding has been controlled, leave the packing in place and wrap and secure the packing. The following video will provide a review of these steps. Hold direct pressure. Wipe away excess or pooled blood, taking care not to remove any clots that may have formed. The wound should be packed deeply. If there is excess dressing after packing, place the remainder on top of the wound and hold pressure. Secure the dressing. It is important to note the same tourniquet used on adults can also be used on children. However, when the tourniquet is too big, application of direct pressure should be applied. For deep core wounds, packing can be used for adults and children of all sizes. Care of both core and extremity wounds begins with direct firm pressure and applying additional bandage if bleeding will not stop. If bleeding continues to an extremity wound, apply a tourniquet 2 to 3 inches above the wound or joint. If core injuries are not controlled, deep packing should be placed into the wound. With continuation of direct pressure once complete. Bleeding is the #1 cause of pre-hospital traumatic death. Requesting additional professional care and resources, along with quick intervention with firm direct pressure, are the most important interventions. Tools such as tourniquets for extremity bleeding and wound packing for deep core injuries significantly increase survivability when direct pressure proves insufficient. Utilizing the principles and techniques shown in this course can save lives.